So this is a 77-year-old woman. She's pseudophakic, and she's had decreased vision and distortion in her left eye for about a year. This is what her OCT looks like. She's 20/80. As you can see on the OCT, she's got a little intraretinal fluid at the edges of her macular hole, but it does have a little bit of that sort of flat top appearance that's present. And you can see that there's some attenuation of her EZ on either side of the macular hole that's there. So here's a surgical video of the repair that we did for this chronic appearing macular hole. Obviously, the first and most important step is really making sure that you get a good hyaloid lift. And so you can see here, we were able to lift the hyaloid with the cutter. For my macular holes and macular peeling, I like to stain with ICG, so I did that there. And then I'm using the finesse loop to be able to create a flap that's present. I think one consideration for a case like this is just to do sort of a large, wide peel of the ILM. But another technique that I sometimes like to employ, if I think that a hole is less likely to close than other, is to actually just do sort of a flap that's present. So I use the flex loop to create that wide sort of ILM flap over sort of the temporal portion of the macula. So first with the flex loop, and now I'm using a pair of ILM forceps to really bring up that ILM just to the edge of the hole, but not to truncate it. So I have a large flap to work with. And then I go to the nasal macula and remove the rest. So I want to get that ILM flap in the right place. When I'm doing my air fluid exchange, you can see that I'm really sort of tilting the eye over nasally to try and get that flap to be able to go over towards to flap over the macular hole. And I'm just going to sort of go back here. It's a little hard to see on this, but you can hopefully see that the flap has covered the macular hole. So I like this technique for being able to give the patient a better chance of getting that hole to close. And this is how the patient did. So this is just post-op month 1, and thankfully they were able to get closure of the macular hole. You can unfortunately see that there's some attenuation of the ellipsoid zone here on the OCT, but really a good anatomical result in someone who has had a chronic macular hole.